feel very fortunate to have a relationship with United Healthcare for several years now, actually. The name, the United name, is very valuable, and also your portfolio of products. I think each year they're better and better, and certainly at the top of the industry.
Our full commitment collectively as NMAs has become an extremely valuable relationship. United Healthcare's commitment to the broker distribution will sustain a strong long-term partnership.
It's a little difficult to place a value on our relationship with a carrier that brings so much to the table like United Healthcare does. We have an opportunity with an organization that stands behind their external distribution. They supply us with different sales tools that are unparalleled in the industry. That's said from the heart. There are different support systems that we don't see with other carriers, and you have a product footprint that's unrivaled. I guess we'd have to say that if we didn't place the utmost of importance on this relationship, I'd be telling you a story.
Good.
United Healthcare is actually a very important partner to us. Not only are they a leader in the industry, but they also have the client's heart at best interest, and that becomes a win-win for us at Premier, because it's what we're looking at after is also the clients.
Well, United Healthcare is obviously a very vital part of what we do. They've been a tremendous partner for us the last 6-7 years. As healthcare reform comes into play, as Medicare changes continue to come into play, we expect to continue to utilize all the expertise United Healthcare brings to us. They can help us in the marketplace and become a vital part of what we do in the future. And so very, very dependent upon them, and with their help, it also helps our success as a company.
Okay, yeah, the relationship with United Healthcare is super important to us. Obviously, we're a national brokerage firm, and the ability to offer a company that is super strong in the marketplace and delivers great value to beneficiaries and agents makes what we do a lot easier.
Well, I definitely don't think I could have had a better partner. I think it's great that United goes into these areas and sort of figures it out for me. They create a roadmap for my success. They go in and they know that it's an area that has great product, where there are a lot of eligible members, and it just only enhances my business and helps me enlarge my footprint.
Overall business and organizational growth.
The importance of aligning with key markets reminds me of the old Sam Kinison joke, and that is, go to where the food is. You just have to sort your priorities, place your resources where they need to be, and go where you can eat. And that's not a desert, so we're going to go where we can eat.
Not only are the key markets very important, but Premier feels it's very important to sell products in all areas, but the key markets become even more important for the fact that the benefits are most enriched in those areas, and we want to make sure clients and seniors have an opportunity to know what their health care choices are.
That's always a challenge, because sometimes the key markets are where everybody wants production, but yet it's usually the toughest place to get production. And so we're always thinking for new ways to engage in the local markets. How can we get inside the right channels of distribution, the key contacts in the markets to try to drive business. So key markets are very important, but yet are also very challenging.
It's critical for us as a distributor to make sure we're promoting products where they can be sold and they're most competitive. We have limited time and resources going into the AEP this year. And for the next 2 months, we need to be laser focused in the markets where UHC feels like you guys can be the most competitive.
I developed a passion for Medicare in 1990 when my career began. I grew up with United Healthcare, which is directly responsible for my compassion for Medicare.
We're in the Medicare space mainly to help seniors, and with the year 2000 well, we're going to have about 76 million boomers coming of age in the near future. And that'll give us plenty of opportunity to help seniors make it healthcare.
Originally it started out as just an extension of a current business practice. And then ultimately we realized that we are a small cog in a big machine of delivering better benefits and better care and lower cost to beneficiaries.
Awesome. Okay.
That was an awesome.
Okay, well, we are, probably one of the newest people on the block in the Medicare business, but I have 11 employees, and we are on the phone constantly with all of our agents. Whatever it takes, whatever it needs to be done, we do it. We make sure that they're in contact with the agent and agency managers who are just wonderful, making sure that our agents are trained and compliant, and ready to go in and meet that Medicare market. So that's it.
I think any description you would have on the support of the agent will vary from agent to agent, but I think one of the things that's crucial is to make certain that an independent agent knows they're not alone. One of the biggest challenges we face is an agent who doesn't have some of the support system you have in a captive environment, and so we look to fill that with adequate back office support, and that includes training, lead programs, different ways of exhibiting things that keep the agent involved and engaged. It's very difficult to birth an agent. It's even harder to resurrect one. So if we keep this same sort of support out there, let them know that they have the support, not only of the carrier, but the program that's looking to support them. The agent hangs around, they make money, and they have a successful career.
Agent support is very important. As a former agent myself, dating back almost 25 years ago, it takes a lot when you're out there by yourself, working on straight commission, and you're like a lone wolf out there. So it's very important to have an organization that you can work with, that you can trust, that can be a liaison out in the marketplace. When you need help, they're there to back you up. Our staff is there to help the agencies that we work with nationally, and then we work directly with UnitedHealthcare because we can be that liaison between the agent and the company. So hopefully we can help them out with the administrative type issues. They go out and do what they best, that's self-running.
Well, 2014 is going to be interesting. Of course, I'm very excited about the AEP coming up. That's going to be great. Can't wait for that. We've been preparing all year. But as far as 2014, it could be a little, it's going to be uncertain with the healthcare environment. Nobody really knows, at least I don't. But you know what? I feel very confident that United is going to put everything in place to make us both successful and to win the game. So go UHC. I love you.
With UnitedHealthcare's long-term commitment and leadership in the Medicare market, we together can dominate the growth for 2014 and beyond.
2014, I think, will be an era of opportunity that we haven't seen since 2013. And I mean that in the best of ways, because a lot of what we saw for 2013 and the results we got out of the season was kind of unexpected. And we're going into 2014 with a little different perspective than what we've had in the past. And a lot of that is because it's the great unknown. And we have still so many avenues that we can penetrate and develop and really produce, I think, to the numbers that all of us really want out of 2014.
2014, I think, is going to be a very challenging year. I think we're all realize 2014 and 2015 will be very challenging to the Medicare market. First and foremost, we want to do what's best for the clientele out there and our agents. We hope we can get stability in the market for the next two years. And after the next 2 years, hopefully we can see tremendous growth in year 2016 thereafter. But we're optimistic, very cautiously, that we can hopefully maintain some very good qualities and very good production this year.